Hello, my name is Sam Feltham, and welcome to Expert Interviews here on Smash the Fat. With me today, it's my pleasure to introduce you to Professor of Cell Biology at State University of New York, Richard Feinman. How you doing, Professor Feinman?
Hi, Sam. How are you?
I'm good. I'm good. Pleasure to have you on the show today. And kind of the reason that I wanted to get you on the show is because you are probably one of the world's leading experts on low carbohydrate diets in their relation to the management of type 2 diabetes and obesity. And you were recently the lead author on a critical review that states the carbohydrate restriction should be the primary treatment for the management of diabetes. Now, you haven't always been, and we'll get into that in just a second, but you haven't always been into diabetes and obesity and things like that. So what kind of led you to this path on which you are now?
Well, on one hand, I'm a person who's been fighting fat all their life personally, and so I personally always knew that carbohydrates made me fat, and so I tended to avoid them myself. Uh, Professionally, I'm a chemist by training, and I work in my original work was in enzyme and protein chemistry, but I did teach metabolism to medical students, and I used low carbohydrate diets as a teaching tool because the underlying principle in a low carbohydrate diet is that you want to focus on insulin, which is a kind of global hormone and controls all the things that you do in metabolism. And so that was a good teaching tool. At some point, we have a lot of second career people and as students, and one of the students wanted more nutrition in the curriculum, and so I wound up having to teach formal nutrition, which meant going back and looking at literature, and then I had to give formal nutrition lectures. I would have to say that I started out with a, well, I would call it a very low-key approach because I really didn't, I knew what was best for me. I didn't know what was the state of the art, and so I had to go back and do a lot of the literature search. And what I taught is, the first year or two, is that there are different kinds of diets, low carb, low fat diets, and so on. And, but as I looked in the literature, I would say I was shocked.
Mm-hmm.
The literature supporting low fat was, if it wasn't a total fraud, it was pretty close. And so that changed my opinion on things. I really got into it because I have some interest in physical chemistry, and the one of the key things in low carb diets is the idea that you can lose more weight per calorie on a low carb diet. And well, I'd certainly observed that, as many people had. But the issue was frequently proposed on the basis of laws of thermodynamics, and so that was an interest of mine, and that's how I got into it. Because, in fact, laws of thermodynamics are widely quoted in nutrition, but at this point, I can just say that nobody knows anything about it. It's one of the more complicated areas of physical science, and in fact the big problem is that most of us who are chemists don't like to claim that we're experts, but compared to what's out there, we know a lot more than they do. So my first professional interest in it was explaining why a calorie is not a calorie.
Mm. And just quickly, in your opinion, why is a calorie not a calorie, not a calorie?
Well, what's meant by a calorie, when you ask people what's a calorie, they give you the physical definition, that it raises the temperature of a milliliter of water by 1 degree and so on. That's not the definition of a calorie in nutrition. The definition of a calorie is the amount of heat you get by burning food in a calorimeter. And what you learn in physical chemistry is that energy goes with the reaction. It doesn't go with the substance. In other words, the calories are not in the food, they're in the combustion. And you use your food for something else, those calories don't apply. If you use it in a more complicated way to make protein, make DNA, it doesn't apply. So there's no expectation. Now, a lot of the time, a calorie is a calorie. You know that. I mean, everybody has the experience that for a single person, or for people who are very similar, macronutrient composition of diet may not be a big effect. But if you do something drastic like you did in your study, there's no surprise in it not coming out right. So that's it in a nutshell. It's not that a calorie can't be a calorie, that, you know, for a particular person. It's the thermodynamics. If anything, its prediction is that it shouldn't be consistent at all. So that's it in a nutshell.
In a nutshell, that's perfect. Perfect.
And of course, our paper received a very poor review from the journal. And in this field, it is what they call in communication half duplex. Nobody really talks to each other. They just put out their own opinion. And every now and then I run into somebody who's actually read our paper. So the contribution was a little bit less than we thought it would be.
Yeah, well, hopefully it'll get more distribution as time goes on. Now, before we move on, can you just center yourself with your laptop?
Oh, sorry, yeah.
Yeah, no, it's okay. If you, that's okay.
I'm trying not to have distracting objects.
Yeah, that's all good. That's all good. Now, the title of your review that was published in Nutrition is called Dietary Carbohydrate Restriction as the First Approach in Diabetes Management. Critical review and evidence base, and the title for this interview is The Evidence Base of Low Carb. And in this report, you had 12 points total that have the complete evidence base as far as we know it, as far as you know it, to present the information that we have available, that a carbohydrate restricted diet is kind of the best place to start in diabetes management, certainly. And kind of the first point that you and the rest of the authors make, is that hyperglycemia, which is high blood sugar, is the most salient feature of diabetes. Dietary carbohydrate restriction has the greatest effect on decreasing blood glucose. And it's almost just, it's inarguable. But do you have anybody that kind of disagrees with that at all?
Well, it's I think you've pinpointed the fact that this underlies everything. Now, there is a movement to try to downplay this, and I can't read anybody's mind. I have the sense that it's a kind of last-ditch effort not to face low-carb diet, because if you accept point one, if blood glucose control is a major effect, not just because it's a symptom, but because it leads to all the downstream effects, then you have to go with a low-carb diet, at least to start. So there is a kind of movement to say that intensive glucose control will have deleterious side effects. You may be familiar with the Accord study, which had to be stopped because some of the people, there were more deaths in the intensive glucose control
Hmm.
arm of the study than in others. But what they mean by intensive glucose control is intensive drug control. And they took people who were at high risk and they hit them with all kinds of drugs. So, you know, it's as if you said that there's something wrong with the target because you can't hit it with the bow and arrow that you have. It's the method that gave you the problem. If you did intensive glucose control, as some people do with low carbohydrate diets, there's no reason to expect you would have those effects. I mean, you might, but you should test it before you dismiss it. I mean, that's the real problem you have here, is that these 12 points have not been rebutted in any way. People just simply ignore them. And I think we've reached a point where you can't keep doing that if you are seriously interested in curing diabetes.
Yeah, absolutely. Because one of the other undeniable facts is that the major increase in calorie consumption has come from carbohydrates, which is your second point, right?
Yeah, I think that's. I think what it shows you most is not so much that we can deduce from that carbohydrates are deleterious, although that's undoubtedly part of the picture, but that there was no change in the amount of fat. If anything, fat probably went down. Certainly as a percentage of the diet went down, but the absolute amount certainly didn't change. And that tells us we're not going to get anywhere emphasizing fat. Excluding things is always much stronger in science than showing consistency. So the more important part is what we didn't find, which is any effect of fat.
Yeah, absolutely. That's a very good point. Very good point. And even if you don't lose weight on a carb-restricted diet, you're still getting benefits from it as well, which is your third point.
I would say that if you asked me for 3 points out of the 12 that were most important, the first would be the one you said, that the first thing you look at is blood glucose, and that responds to low-carb diet. The second one is that it tells you that it's the carbs, not the calories, that's the problem in diabetes, which is not to say that it's not beneficial to lose weight as one approach to diabetes, but it's not easy to lose weight. You know, I always say that there are lots of diets if you're young and male, but even there, losing weight is not that easy. If you can get a benefit for diabetes, which of course is a great health risk, without having to lose weight, that's got to be a benefit for the patient. The third thing, if I had to pick out those 3 things, it would be those 2, and the fact that head-to-head comparisons, or even across trials, low-carb diets just do better. They do better on everything. They do better on glucose control, on insulin. They do better on what's called atherogenic dyslipidemia, all those markers that are risks for cardiovascular disease. And most of all, they improve every aspect of diabetes.
Yeah, absolutely, absolutely. And also on carb-restricted diets, the adherence is kind of higher as well.
Yeah, well, that's a big problem because you know, it's hard to get data on that. People in a clinical trial, it's hard to tell because it's a question of how you do the diet. If I motivate you, you'll do it. I always give the example. A friend of mine who's a psychiatrist describes a patient who comes in and says, I can't lose weight. I try everything. I've tried every diet. I can't lose weight. And he says to her, well, if I told you that I kidnapped your son and I was going to kill him if you didn't lose 5 pounds in the next month, what would you do? She said, I'd lose 5 pounds in the next month. So, you know, if you motivate the patient, they will do it. And there's much greater motivation in diabetes than there is in just being thin.
Hmm.
In addition, all these trials, well, many of these trials are run by people who go in firmly opposed to low-carb diets. And the fact that they even get even, in fact, you usually win, says that adherence to a low-carb diet is fantastic. Uh, but so what's out there in a scientific sense, we don't have a lot of good information. What you can say is that it's not really a question of which has better adherence, but whether there's large-scale adherence. That millions of people, literally, you go to the Low Carb Forum on internet. It's called the Active Low Carb Forum.
Hmm.
They have 150,000 members, and not every single one of them did great, but most of them did, and most of them have stayed on the diet for years, and they're doing fine.
That's fantastic, and that's kind of what we need, really. We need this mass adherence to guidance and to properly formulated guidance as well, isn't it? And kind of one of the guidelines that we've been following for the past kind of 40 years is that saturated fat is going to kill us, you know, through coronary heart disease. So in your report, in point number 7, there you talk about the fact that there isn't actually any correlation at all.
Right. Well, what we know is that we can't find anything wrong with saturated fat. Some people may be sensitive to it. Some people may benefit from it. It may be good. We just don't. We just whatever there is out there, we can't get a grip on it to say that it's bad. And so, what do you do in those situations? Well, you do what we always did: is you eat normal food, and if you feel good and you get better in your diabetes, then you're doing the right thing. Uh, I mean, I always draw the analogy to a court of law. In a court of law, you can't be found innocent. You know,
Mm-hmm.
you can only be found not guilty. And saturated fat is not guilty. Now, if you are accused of being a child molester and you are found not guilty, people still won't let you move into their neighborhood. Uh, and saturated fat, carries stigma despite the data. But it shouldn't have been indicted in the first place. There wasn't real evidence to even start the thing. On the other hand, what we can say is that we do know that lipids in the blood clearly affect physiology. So that saturated fatty acids, that's the fatty part of the fat, in the blood can have effect on insulin resistance and other effects. But that doesn't directly come from diet. And it may be controlled much more by carbohydrates. So the data on what's wrong with a high-fat diet is that if you do a high-fat diet in the presence of high carbohydrate, which will have the effect of making the fat deleterious, that's going to be very different than if you have high fat in the presence of low carbohydrate. The carbohydrate is the controlling element, directly or through insulin. The fat is kind of passive. So you can make a high-fat diet bad. You just put in a lot of carbohydrates. There's never actually found a really good analogy, but it's like carbohydrate through insulin and through glucose, like the faucet, the handle on the faucet, and it adjusts the flow of where the fat is going to go, whether it's going to have a deleterious effect or simply going to be oxidized.
Mm. Absolutely, and that's kind of is point number 8 in the report, is that plasma saturated fatty acids, which is kind of the saturated fat that's actually in the blood, are controlled by dietary carbohydrates more than dietary fat.
Yeah. If
Which is
there's a
kind of
take-home
interesting.
message, it's that carbohydrate is the control element,
Yeah.
and fat does what it's told.
Perfectly put. Perfectly put. And then the other one, point number 10, is that dietary carbohydrate restriction is the most effective of reducing serum triglycerides, which is another risk factor for coronary heart disease as well. and that's really important, isn't it?
Yeah, well, there's a figure in that paper which I think tells everything. And what it was is that there was a study on low glycemic index diets, which were better than the diets recommended by a lot of the health agencies, and they got decent results. But at exactly the same time, by coincidence, Eric Westman compared low glycemic index diets with a real low-carb diet. And there's a drastic difference on everything. And triglycerides are the kind of indicator of a low-carb diet. You want to reduce your triglycerides. Now, there's a lot of controversy about whether triglycerides are the major risk factor or whether it's something else. But if you take it, just ask the question. Don't ask how important triglycerides really are. If you want to lower them, you go on a low-carb diet, they'll go down. You take 10 people with high triglycerides, and you put them on low-carb diets. I'll give you $10 for everyone whose triglycerides go up. You give me $1 for everyone whose triglycerides go down.
That's awesome. Yeah, it's a that's a good bet. And well, not for me. If I'm the one that's going to be using that.
You would be out of luck. Yeah.
That's right. And it's a consistent effect when people go on carb restricted diets, is that we see triglycerides go down. And another thing that we see go down as well is if people are on type 2 diabetes medicine, is that they have to dramatically reduce that medicine, or even in some cases it completely eliminates the medicine.
Well, because I knew about this for a long time, it didn't have the same effect, but I was with a colleague who's a physician, and we were at a conference, and the data was presented from Will Yancey and Eric Westman did some very good studies on this, and they had, I remember the exact details, they had about 20 patients, and of the 20, 17 of them reduced their medication, and about 7 completely came off the medication, and my colleague was astounded. I mean, coming off medication is a sign that you're getting better. It is, however, one of the important caveats. If you're going to go on a low-carb diet and you're already on medication, you have to do it with your physician, and your physician has to take the trouble to find out how you do it, because you have to taper people off the medication before the diet.
Yeah, that's right, isn't it? Because it's I mean, we spoke to Dr. Eric Westman, one of the co-authors on this, and yeah, he was very, very insistent that if you are a type 2 diabetic, that you do this in unison with your doctor, just to make sure that you don't put yourself in any danger with over-medication, I suppose, is the best way to put it, is it?
Well, I think if you look at it, the risk is hypoglycemia, that is your blood glucose will go down because the diet's doing the same thing that the drug does. And, the flip side of that is that it's one of the clearest evidences that the diet is good. It's doing what the drug is doing, and there's no side effects. I mean, really, the resistance historically to low-carb diets, by historically I mean the past 30 or 40 years, is, quote, concerns. And these concerns never materialize. They're all hypothetical. And what that also bears on is the idea that you need to study a low-carb diet in a random controlled trial for forever. What you know about the diet is that it works well in a week, and there's no side effects. And if you keep the patient on the diet for 2 weeks, it works still better. And after a year, it's still better. And if you call for 2 years, when there are 2-year studies, then people want a 5-year study. And if you find a 5-year study, they'll want it out to the crack of doom. it's not reasonable. That you don't assume risk in something that you know, and you know low-carb diets. There, lots of people go on them naturally. The very high background carbohydrate availability is not historically pervasive, but most of all, it's not what everybody eats normally. I mean, and not just people who were fighting fat and notice that carbohydrates are bad, but some people have taste for that kind of food, and there's no demonstrable risk. So.
That's right. That's right. And this kind of brings us to our listener question through the Facebook comments on the blog. Sorry there, Professor. I think I lost you there for a second. Can you hear me now?
Yeah, I hear you fine.
There we go. Perfect. So yeah, this kind of brings us to our listener and viewer questions. This one's from Larry Diamond, who lives near Austin in Texas, and he asks, on that, how long can deniers deny, and how long will it be until lawsuits are kind of put in place?
Yeah, it's always easy to answer a question that has the answer. They'll continue to deny until there's a lawsuit. Now, hopefully we don't have to, that's how we usually do things in America, but hopefully we could do better. Well, in diabetes, it's worth understanding that it's a somewhat more complicated system. The American Diabetes Association has outrageous recommendations, and it's more that what they refuse to look at, which is low carb, than what they recommend. But I don't think most of the rank and file members know what the nutrition committee says, nor do they care. So a lot of people are on low carb diets to treat diabetes, and a lot of physicians recommend it in one form or another. Now, the low glycemic index is a kind of politically correct form of low carb diet. It's not nearly as effective, as far as I know, but it's a sign that people recognize that this is a disease of carbohydrate. The real problem, of course, is that the average clinician in the United States is drastically overworked, rarely has time to fill out all that paperwork, never mind fighting with the American Diabetes Association. Mm-hmm. So in that sense, it's not black and white. There are a lot of people who do see the value, and there are a lot of patients who see the value. As for denying Ansel Keys, I always think back to a conference in Sweden, which was giving an award to Uffe Ravenscoff, who was one of the major critics of the cholesterol hypothesis. And a lot of the speakers before me quoted Max Planck as saying that if you wanted to get an idea in science to change, you had to wait for the old generation to die out. When I spoke, I pointed out that since I was in that generation, I hoped we could do it a little bit sooner. So that is still my hope. Ideally, it won't take a lawsuit, but you never know.
Yeah, hopefully, kind of the truth will persevere and come through. Because,
well, there's definitely a movement to for what I call slouching toward a low carb. So the American Diabetes Association now recommends individualization, but they don't tell you how you individualize anything. So that recommendation is, well, it's like when you hear on the radio 20% chance of rain. You don't know any more than you knew before you read their guidelines. You know, how do you individualize it? Well, next time around, that they will probably say those people who do well on low-carb diets, it might be okay to recommend it. So, but in something like this, gradual changes in order to save face don't ring a bell with me. They should say what's true.
Absolutely, absolutely. Very. And unfortunately, that's all the time that we've got today. There's one more thing we need to do with you, and that's to hear a smash it out from Professor Richard Feinman. So on three, I'd like you to shout "smash it out" to the camera. So 1, 2,
Wait,
3.
what do I? What do I have to shout?
So just shout, smash it out to the amazing to have to Feinman shout that. It's brilliant.
I'm sorry, but just at that moment, the sound is cracking up, so I don't know what to shout here.
Oh, sorry. Smash it out. Yeah,
Well,
that's what talent. So 3.
well, I can't understand what you're saying, but I'm gonna read your shirt, and I think we should smash the low-fat people. Well, that is, smash the low-fat idea. We'll like them when they come along.
Where can you...
I'm afraid we got very poor transmission at this moment.
Do you get that?
I'm afraid you dropped out for a while.
Yeah. Is that better now?
Now I can hear you.
Asking whether where we can actually read your thoughts on all things diet and health.
Yeah, I'm afraid I lost you, so I can't really tell what question you asked.
Okay, sorry, Professor. If you can hear me, you can more about and health. Dr. Feinman, that's Drfeinman. And yeah, was there anywhere else at all, Professor, that you'd like to share with our audience?
No, I think we covered the main points, but I think the take-home message on this is that whereas our 12 points are the most unambiguous and least controversial in diabetes, there is a view that diabetes is an extreme for all metabolic diseases. And so if you have metabolic syndrome, which means that complex of markers, overweight, high blood pressure, and so on, it may be that a low-carbohydrate diet is also best for that. I'm not particularly doctrinaire. I think if you're okay, you're okay. If you don't have a weight problem and you don't have a health problem, then you're probably eating the right thing. Some of my colleagues think a low-carb diet is best for everybody. Our compromise on that is you probably don't have to be on the very best diet. If you're doing fine on what you have, you should go with it. So that's my final word.
Absolutely, it's a very balanced view. Very good, Professor Feynman. And yeah, I just wanted to say thank you for all the hard work that you've put in over the decades, and also thank you for your time today.
It was a pleasure.
Brilliant, brilliant. And hopefully, if we manage to change things around the globe with this new critical review, then we can get you back on the show, maybe to do some more some gloating perhaps, and sort of
Well,
explaining
it's
where we
really,
go from it.
it's really that I'm a spokesman for the other authors, but if we do win, I'd be eager to take as much credit as possible.
Absolutely, absolutely, Professor. Absolutely fantastic. Well, you have a good day over there in Oregon. And I know that you're going to be speaking at the Ancestral Health Symposium. So I look forward to kind of seeing those videos go up on YouTube as they come up on their YouTube channel as well.
Okay, thanks a lot, Sam.
Thanks a lot, Professor Feynman. Take care.